So you have your vaccine, you're getting ready for weddings, you're getting ready for the Derby, you want to be able to smile in pictures, you would like to throw away those dentures. We're going to make that happen. With me now is Dr. Regan Ackerman from Freedom Mini Dental Implants. Dr. Ackerman, welcome back to the show.
Thank you. Thanks for having me.
Yeah, I would think this time, we talk about how certain seasons are good for some businesses. Like right now, a lot of seasonal vegetables getting ready to come in and all this kind of thing. For you, oh my goodness, I would think people, this is the time to smile, right?
Yes, to smile, and they want to be able to eat again, get rid of their dentures, throw away the denture glue, taste their food again, like you said. Yeah, prime time, and we're getting a little bit closer, not all the way, but getting rid of masks, and people are getting a little bit more self-conscious, about their smiles again. And
yep.
So yeah, it's time. Spring and summer. Doesn't look like it outside with the snow, but it's here.
Yeah, and I think what's unique is a lot of folks may be watching now and saying, okay, I've always wanted to throw away my dentures. Why is this different? Freedom Mini Dental Implants is something you might not be familiar with. It's not new technology. It's been around for about 17, 18 years or so, which, Doctor, you can talk about this. But
yes,
but folks, maybe in the past they were told, well, you're going to have to go through all these multiple surgeries, and you're going to have to come back in, you're going to have, we have to wait for the bone to grow and all this stuff. This is different, less expensive. It's all good news.
Yes. So the mini dental implant, it's just a smaller diameter implant. So it's a lot less invasive. So just like you said, people that were told they weren't a candidate for implants before can be a candidate for the mini implants. Because I always say I don't have to have a lot of bone. I just have to have some bone because it's a smaller diameter implant. I don't have to do bone grafting or sinus lift surgeries. Don't have to take you off a blood thinner, people with medical histories, a lot less invasive surgery. But like you said, it's been around for 15 plus years. So a lot of people that have been wearing dentures for maybe 10 plus years, they're just struggling with their denture at home, and they don't know that this is an option for them. We do, I know we'll show the models later. We'll do the snap-in denture or the permanent teeth where you can get rid of the denture completely and not even have to worry about the denture at all.
See, that's almost hard to really put your arms around. Get rid of your dentures completely. Throw them away, and it is possible. And as you said, I love the fact that you're not going to go through surgery. It's not going to be painful. It's really just a little bit of numbing, and it's very quick. It's a fast turnaround, not a lot of sit around and wait.
Right.
It's really all good news, and the fact that it's less expensive, everyone's on a budget, that's good too.
Yes, yeah, and I know that's the biggest question is always, cost and budget. It's hard. The consult is free, so you make an appointment. There's no charge for the consult. We take a 3D x-ray. We'll go over cost and financing at that appointment, but on average, I would say the mini implant is usually about a third to half the cost of the surgical implants.
Yeah, wow. So let's I always like showing clients of yours, patients of yours, and the results, the before and after, because not only is it less expensive, less invasive, not painful at all, but the smile, it erases years. You look much more youthful. So tell me about Ron here.
So this is Ron, and he came in, and his teeth were just failing on him. Like a lot of people had done everything he could to try to save them, but they had broken down. You can't really even see him when he was smiling. This is how he came in. So he had to have all his teeth extracted, and then we did the snap-in dentures for him. And so now you can see he's got this beautiful smile. He shows his teeth again. It just makes a huge difference, and definitely, a confidence booster for him. We did the snap-in denture, so he didn't have to use denture glue anymore, and, just a much better, stable denture for him.
I like the fact that you said confidence booster, because I think a lot of people think, well, you're able to eat the foods that you love, like meats and vegetables and things that you had to avoid with denture glue and dentures, but also the confidence, whether you're someone who's single and out dating, or you're someone who's applying for a job, or you're someone like myself who wants to appear more youthful because the competition is a lot younger,
Yes.
So there's different reasons, but it's all good, and I understand every single one of them. Some people may say it's superficial, but looking better works if you feel better.
Especially, I have people, wanting to go to job interviews, and definitely confidence booster, and they don't have to worry about, oh, is my denture going to flop or move, on that job interview, or just being around family and friends and being able to go to social functions and order your dinner at a restaurant and not have to pick and choose off the menu or be self-conscious about the way you eat and how you eat, or excuse yourself to go to the bathroom because your denture's fallen out. you know, if you wear dentures or you have a family member that struggles with that, you know exactly all these scenarios.
Yeah, and if you have a question, maybe you have a personal case, whether it's about your spouse or a family member, as Dr. Ackerman mentioned, 571-5263, and she can address those questions. Let's talk about some of the challenges that denture wearers have. First and foremost, I would think you hear these every day, but I would think that the taste and how bothersome denture glue is has got to be a big one.
The denture glue is number one. I actually had a patient come in this week. He's like, you know, it'll stay in, but as soon as I try to eat, that denture glue just like disintegrates. And he's like, especially when I try to drink my beer. He's like, it's like the alcohol just disintegrates it. And I'm like, I can see that. So yeah, getting rid of that denture glue is key to doing the mini dental implants and having a snap-in denture. You still wear the denture 24/7. You're just going to snap it out once a day, rinse and clean it, and put it right back in. But no more denture glue, because that denture glue, you're right, it doesn't last. People have, I mean, they carry around tubes of denture glue because they have to reapply it 4 or 5 times a day.
Yep, and 'tis the season for smiling. And if you're not confident about your smile, maybe you opt out of some of the wedding pictures, derby pictures. You find that to be true a lot. If people aren't comfortable with their smile, they don't feel confident, they tend to go, okay, I don't want to get in this picture, right?
Certainly,
that's kind of sad.
And I know we've talked a lot about dentures, but especially too those people that are missing just one tooth in the front, or they have a flipper. We do single teeth as well. I know we'll show all those models later, but it doesn't have to be all your teeth. We do, you know, even if you're missing your chewers in the back, your molar teeth, you know, you want something more to chew with, we do, you know, 1, 2, 3 teeth. We do multiples as well.
So what we're going to do here is we're going to take a little bit of a break, and we're going to open up the phone line. So if you have a question, you're wondering, am I a candidate? You probably are, but if you have a question about maybe a certain health condition, 571-5263. Maybe you have a question about, you know, your favorite foods that you'd like to eat and bring back, anything. Give us a call. Dr. Ackerman will field those calls next on Wave 3 Listens Live.
If you've been injured in an automobile accident, you don't need an attorney making you false promises just to get you as a client. You need a straight shooter. I'm attorney Jim Desmond, and the number on your screen is my cell phone. So stop the nonsense and call me today for direct, immediate legal advice.
If you or someone you know has sold a home in the last 10 years, you've probably heard of radon. Radon is widespread and the second leading cause of lung cancer. If you're planning to sell or stay, call Verified Radon Safe. VRS's accurate readings will come back in just a couple of days. For a limited time, save $50 and get your home tested for only $149. Remember, your home isn't safe unless it's Verified Radon Safe. Call 502-91-RADON or go to verifiedradonsafe.com now.
Watch the Ashley Home Store's Great Bet Races, Monday, April 26th at 7:30 p.m. on Wave 3 News, your official Kentucky Derby station.
It's the grand opening of a brand new Big Lots in South Louisville.
Gotta go big if you want it, where you want it.
Big new look, big name brands, big deals on everything for your home. It just might surprise you.
Gotta go big if you want it, gotta go big.
The new Big Lots. You just gotta go.
Hi, I'm Tim Jones, back for Toyota of Louisville, and we've got Derby deals. A 21 Corolla with Safety Sense and Toyota Care Standard. Listen to this, 36-month lease, payment of only $129 a month. Have you got a trade? We want your trade in. Simply come by, let us give you an appraisal guaranteed for 7 days, or get 0.9% financing for up to 60 months. Easy to get to, Dixie Hwy or ToyotaofLouisville.com, a Swope dealership where nobody walks away.
Freedom Mini Dental Implants. Dr. Reagan Ackerman is here with us, and if you have a question, 571-5263. Dr. Ackerman, you and I have, over the years, gotten to know each other pretty well here, but for those who aren't familiar with you and your background, tell me about what brought you to this particular expertise, Freedom Mini Dental Implants.
Certainly, yeah. So I am a general dentist, and I had my own general dental, practice. And just, as patients struggle, I as a dentist struggled to find a better option for my patients, because I didn't like telling people that they had to have dentures either. or, you know, had to tell them they had to have an implant, and, you know, it was going to be a year-long process and surgery and all of this. So I was looking for a better option as well. So I found and went to some continuing education courses and discovered the mini implant and fell in love with it. And I think, you know, Dr. Stroud was on here for a while, and he retired, and so I took over his mini implant practice. And these mini implants are just a great solution for patients. You know, one of my first patients was my mother-in-law, and we, you know, replaced, you know, a majority of her teeth, and, you know, she just loved the mini implant. She said, it's like I grew my teeth back. So the mini implant to me was just as gratifying as, you know, my patients getting it, because it gave me a better option for people, a much less invasive option, more in people's budget for sure. You know, financially they could do the mini implants and get them out of denture. So, you know, if I had to tell somebody that they did have to have all their teeth taken out, I had a much better option to offer them than just regular dentures.
Okay, and you use the word option, so let's talk about the options that you offer. You mentioned it doesn't have to just be dentures. It can be one tooth. It can be a number of teeth. You mentioned the flipper, a bridge. You can take care of all that. Yep. So I like the third set of teeth.
Okay.
The throw away the dentures, no plastic whatsoever. If you don't mind showing them that model, you offer this, and I think this is a great option.
Yes. So if you do have to have all your teeth taken out, this is definitely the best option. This is kind of what we call the permanent teeth. So essentially, you can see this model. These are the mini dental implants. They're just a smaller size implant, so a lot less invasive. So when I place these implants, like you said, just a little numbing. A lot of people know it as Novocaine. No incisions, no stitches, okay? When you leave that day, you know, you're not bleeding or swollen, no stitches or incisions. So we'll place these mini implants, kind of, you know, everybody's mouth size is different, but then we're able to make this bridge of teeth.
That's it.
So that's it. No plastic, nothing covering the roof of your mouth. And this bridge will get cemented on permanently onto those implants. So it does not come in and out. It is like having your teeth back.
You brush them, everything.
Brush them, but you get to taste your food again because you have nothing on the roof of your mouth anymore. But yes, you're going to brush them just like you brush regular teeth. We give you a water pick to help keep them clean, but they don't come in and out, and it's just like having, you know, your teeth back. So it's a great option, especially to get rid of the denture.
My question would be, just by looking at that model, is durability as far as the porcelain and everything. How durable is it, Doctor?
Very durable, yes, very, very
just like
durable.
your teeth?
Yeah, just like your teeth, certainly. So yeah, they're very durable.
Okay, that's one of the options, 5715263, if you'd like to talk about that one. Now, let's show you, Ron did this option, is this right?
Yes, so he did the snap-in denture. So this is another very common procedure we do. And same thing as far as the mini implants go. So you'll see, you know, imagine this is your mouth or your gums without teeth, and these are the mini implants. Small diameter, no incisions, no stitches, just numbing. And the other great thing about the mini implant, because it is so less invasive, the day I put these implants in, I'll put these attachments inside your denture, and you will leave with the denture snapped on to those implants that same day. You don't have to wait another 3 to 6 months for the implants to heal. Yeah, and no more glue. The denture just snaps right onto those implants, and no more denture glue. And your denture is a lot more stable, so you can eat better. It's not going to flop around. You don't have to worry about it, you know, falling down or flopping out. So that's what we call the snap-in denture.
So for those who are happy with their dentures, you can have that option.
Yes.
But if you'd like your third set of teeth, you can have that. Look at Ron.
Yep. There he is.
Ron's a handsome individual.
Snap-in denture. So yeah, he can eat so much better and chew better and not have to carry around tubes of denture glue with him.
I know you've been doing this for years, but are you amazed sometimes about how it does erase years off of someone? I mean, it really does. It's like the fountain of youth. Teeth, I don't know. It's just something to be said for a nice smile. Yeah.
Yes, yeah. I mean, I've seen, I had a friend send me a picture of a person, you know, missing an eyebrow and missing, you know, a front tooth. Nobody even notices the missing eyebrow, but you always notice the missing front tooth. And, you know, that's
I never
what
thought of
people
that.
look. Yeah, it was a great picture somebody sent me to, and it just goes to show how important our smiles and our teeth are, because that's one of the first things people notice.
And Doc, you mentioned the fact that if it's one tooth, maybe it was something that happened to you genetically, you're missing a tooth, or maybe you had a car accident, maybe a sports accident with baseball, whatever, you can help them as well. You know, don't put it off. This is not a big, long process. It's pretty quick.
Yes, yeah. We do the single teeth as well.
Yeah, if you want to show us, please do. Please do.
So this kind of shows, like you said, a lot of people either were born without a permanent tooth in the front, or like you said, had trauma, whatever reason, or missing, a single tooth in the front. So same thing, we just place that, single implant there, and then we have the nice pretty tooth, and then that gets cemented on to the implant. And same thing, it's not a year-long process like the surgical implant. The day I put the implant in, you'll leave with a temporary tooth on there that looks like a tooth. So you get rid of that partial or that flipper or even that just empty space, that day. So we do a single tooth, and then this kind of shows you in the back, if you're missing 2 or 3 teeth or, need more to chew with back there, we do that as well. So, placing the implants the exact same way, no incisions, no stitches, and then this little bridge of teeth is made, and it gets cemented on to those implants permanently. So it does not come in and out. So you don't have to worry about, if you have a partial that comes in and out, you don't have to worry about that anymore as well.
571-5263 if you have a question. Before we get into that, I want to ask about the free consultation. What is that experience like? If someone says, I want to see if this is a good fit, so to speak, for me, how does that work?
Yeah, so you just call, make the appointment. It's no charge. We'll take a 3D x-ray to make sure, you have enough bone and you're a candidate. And then I will go over your options, show you the models, and we'll go over cost. I know that's always the #1 question.
Sure.
And go over, we do offer financing plans and what your options are there.
Okay. Now, we've shown all kinds of models here, but there's one that we have not shown, the jawbone, because I think people wonder, how do you do this? Why isn't this technology been around forever? And why do they need more bone when they do the old-fashioned surgical method?
Yes.
Here's why, and I think this is interesting because it tells the story.
Volumes. It makes more sense, I think, when you see this. So let's see. Let me get the angle because the hole I make is hard to see. So the little hole, that is the hole I make, my little pilot hole through the gum into the bone when I place a mini implant.
The little one, the one you can't see.
The little one, yeah. The big hole is the surgical implant. So you can see why they have to have a lot more bone, have to do bone grafting, sinus lifts. They make an incision, flap open your gums versus the mini dental implant. I don't have to have a lot of bone. So a lot of people with minimal bone told they weren't candidates for implants are candidates with the mini implant.
All right, let's grab a phone call here and chat with Larry. Larry, thank you for watching. You have a question for Dr. Ackerman? Hello, Larry. Turn down the TV because it's a delay, if you don't mind.
Yes. I have a heart condition.
Okay. Go ahead, Larry. Don't listen to the TV.
And I'm wondering if, I have a heart condition where I've had open heart surgery. Am I a good candidate for the small bones?
Yeah, so you can still be a candidate for the mini implants, even if you've had, open heart surgery or stents or even a heart valve replacement. You still can be a candidate for the mini implant. You just have to come in for the consultation and make sure, you have enough bone for the mini implant. But as far as the heart condition, you should still be a candidate for the implants.
And as you mentioned, you don't need much bone. So maybe the old surgical method, yes, they would need more. In your case, it doesn't take much.
Yes.
Okay. All right, you're probably a candidate, in other words. All right, if you have a question, 571-5263. We'll take a little break. Phone calls on the other side. Thank you for watching Wave 3 Listens.
If you're a Medicare beneficiary and live in the area, call now to see how this little card could get you some big benefits, including money added back to your Social Security check. With one toll-free call, you can find out how easy it is to get all of your original Medicare coverage, plus extra benefits. You get an all-in-one plan designed to fit your needs so you can be your best every day. You could have medical coverage, prescription drugs with $0 generics, dental, vision and hearing, plus the WellCare Visa Flex Card, money for over-the-counter items, and money back in your Social Security check each month, and so much more. And here's more good news. You can get this WellCare plan for a $0 monthly premium. How can WellCare offer all of those benefits for a $0 monthly premium? It's simple. Medicare Advantage and Medicare Part D prescription drug coverage are important parts of Medicare. WellCare has a contract with Medicare to offer and provide these important options to you. Call right now to get your free copy of the WellCare All-in-One Guide. Call 1-855-281-3427 now. There is absolutely no obligation for requesting this free information. WellCare offers benefits that go beyond the basics, including up to $900 each year added to your Social Security check to help cover your Part B premium. Call today to get your free copy of the all-in-one guide with absolutely no obligation. Your free plan guide will give you the details you need to make a smart choice for your Medicare coverage. Just call 1-855-281-3427. Remember, there's no obligation for requesting this free information. So call 1-855-281-3427. WellCare, beyond healthcare, a better you.
So when your horse wins the Kentucky Derby, courtesy of Freedom Mini Dental Implants, you can go to the winner's circle, get that big photo taken, and smile and be proud of it, right, Doc?
If your horse wins at the Derby, yeah, call me. I want to go.
We'll even take care of the horse.
Yeah.
Jerry is on the phone. Jerry, welcome in, and thank you for calling.
Thank you. Welcome.
You have a question for Doc?
Yes, I do. I had an accident several years ago, and it took out 3 of my teeth, upper left. I've got a flipper and have had that for quite some time. I've been told that I would have to have some cow bone or something to use as a filler in there. Now, there are 2 screws in that area that pull the bone together and busted up my face when that happened. I was just wondering how much procedure will that be? I know price is not going to be mentioned, but how long that would take.
Yeah.
And they told me about putting implants, 1 on each side, and bridge the 3rd.
Yeah, so, certainly come in for the consult, and we'll get that 3D x-ray to see where those screws are that you had placed when you had that trauma. Because it may be a case where I don't have to do the bone grafting, and I can work around, the screws and place the mini implants. And if that's the case, we would place the mini implants, in one day, and then, you'd probably leave with the temporary that day, and then you come back about a month later and get the permanent teeth cemented in and get rid of that flipper. So I've definitely seen patients in your case that had trauma, and they have those little screws in there, and we've been able to work around them in the past. So it just kind of depends on the positioning of them. So, I definitely welcome you to call and make the consultation and see if, we can work around those screws and place the mini implants without having to do all that bone grafting.
Yep, and thank you for the call, Jerry. The consultation is free, by the way. So something else that Jerry mentioned, he said, I know you don't talk about cost. The only reason that is, first of all, it is significantly less than that traditional method. That's for sure.
Yes.
And it's because everything is it's personalized. You can't tell until you take a look.
Exactly. Everybody's different. Everybody's situation is different. Some people come in with a denture, that looks good aesthetically, fits good, everything's good, we just need implants. Other people come in and they need new dentures, so the cost is all, different. But traditionally, like we said, usually the mini implant is about 1/3 to half the cost of the surgical implants. And the process is usually a lot less because the healing time is less versus the surgical implant.
Okay, now I'm getting word on a caller, and I want to make sure I have this clear, so help me out here, Tammy. Now, apparently this guy, he has 2 missing teeth. He's getting the other ones replaced. Is that right? Yeah. Okay, so he only has 2 missing teeth, but one doctor wants to replace them all.
Okay.
And instead of just taking care of the 2 teeth. This, again, is probably going to need a consultation.
Right.
But just by hearing that story, don't give up on all your teeth if they're healthy, right?
Right. And it all depends. And there may be a reason his other dentist is telling, if there's a lot of bone loss or those other teeth have a very poor, questionable long-term prognosis, then yes, long-term it might be better just to go ahead and have them all done at the same time. So yeah, it just depends on the stability of the remaining teeth.
Yeah, and there's so many advantages to Freedom Mini Dental Implants. And really, if you go down the checklist, there's really no negatives. It costs less. It's less invasive. There's no pain involved, and no more denture glue. Throw away your dentures. It really is. I can understand the attraction for you going back to your history.
Yes.
Family dentistry, root canals, cavities. That's tough to deal with. This is all good stuff.
Yeah, and this is very rewarding because you see so many people struggling with it. I have people come in every day, especially that bottom denture. Your tongue's trying to push it out. It just flops around. Nobody's happy with it. So a lot of times, if they come in with a denture, they like everything about it and they just want it to stay in, I can use the same denture and place the implants. And get a snap-in denture like Ron.
There we go.
smile.
There we go. Be like Ron. He looks really happy. I mean, that smile there on the right looks like a genuine smile. So again, Freedom Mini Dental Implants. Dr. Ackerman, if you would, invite folks out. The consultation is absolutely free.
Yes, no charge for the consultation. The office is, on Dixie Highway, right across from Valley High School. Definitely, I know some people, East End, it's kind of a drive, but it's definitely worth the drive to have, a much less invasive implant that's a lot easier to place and less expensive.
Yep, have that smile. Smiling and profiling for Derby time. All right, we'll take a little break here, and then Don G will join me in studio, and we'll talk about what's coming up at 2 o'clock. Wave Country with Don G.